I can't get out of my head that I was sitting across from Anthony Fauci, and this was in August of 2020. And he looked at me and he said, one of the biggest problems is the American public is not afraid enough. And I said, I just sort of said, can you just repeat that? This is at a task force meeting. And he said it again. And I mean, this is completely unethical way to do public health.
Yeah, and it's not very effective. We know that because people who are afraid, they don't do logical things.
Right.
But if they have good information, good knowledge, I mean, people are not stupid. They can sort of understand, okay.
It seems so easy listening to him. It's as if, and this was so obvious, which I actually thought was one of the frustrations for those of us who also thought it was obvious on what to do. Did you feel that Sweden's population was extremely fearful, or what was the general mood of the public?
No, I think they were less fearful than many other countries. I had some interesting meeting with the Nordic Council afterwards, who went around to the different countries to discuss and follow up on the pandemic, and their distinct impression was that people were a lot less fearful in Sweden than they were like in Norway, Finland, and Denmark. And probably because our message was different. We can handle this if we work together. And sometimes when I come out and talk about this, they say that the difference in Sweden was maybe partly because we talk to the population like they were adults, not children that you need to sort of tell, don't go there because you're going to get hurt.
What was your reaction to what was going on, if you remember, with the sort of frenzy and the media? I feel is quite vicious in the U.S. and elsewhere. Was this something that was shocking to you, to see how we and other countries were reacting to your advice?
The reason why I didn't think, or we didn't think, because we're a whole group of us, that it was very important, because many times when we talk to the experts in the different countries, they could tell us on the telephone line and so on, I think you're probably doing the right thing. We are not too happy about what we are doing here, but we cannot do very much about it, but we follow you with interest, and most likely you're doing basically the right thing. And that's really made it possible for us to continue, because we really felt that there are many knowledgeable people in the world who actually think like us. And I think you said a very good thing in the beginning. I mean, this is seen as a completely new disease, but it's not really. I mean, it's another viral respiratory disease, and we know quite a lot of them, and we know that can vary, but they vary not to just anything. I mean, they are reasonably constant. So to say that we knew nothing is not right.